If teachers around the metro area get infected with coronavirus, of course, they're going to have to call out sick and quarantine. So, we want more perspective on how the pandemic has impacted people who call out sick from work. It turns out nearly twice as many Americans called out sick at the beginning of this pandemic than they did last year. Researchers say that means coronavirus is impacting more people than we might think. Channel 2's anchor George Estevez asked a Harvard professor to sort out the findings.
So right off the bat, Adam, what does this number mean to you?
Well, it means that the COVID-19 outbreak is affecting far more Americans than the overall case count would lead you to believe. We found that 2 million Americans were out sick from work. That's nearly double the number a year previous. So this is a very big impact.
Okay, so how did you guys come up with this number? What was the formula here?
Well, we analyzed a large government survey that's typically used to determine the number of unemployed Americans or Americans out of work. And we used that to look at the number who were out sick from work because of their own illness. And that allowed us to calculate the increase, the number of homes sick with illness compared to a year previous.
10 seconds. Why'd you pick April, by the way, that second week?
That was the height of the first wave of the COVID-19 outbreak. Unfortunately, we're seeing a second peak now.
Could there be a mistake in that second week? Could there be more? Could there be less?
Well, certainly we don't know the particular illness of each individual. So there may be some of those individuals who are sick from other things. The reality is that we only looked at workers. Many elderly would also have been affected who we would not have counted. So I think overall this very well could be an underestimate.
Tell me about who called out sick. Do we know a breakdown of ethnicity or male, female?
So, sometimes outbreaks get referred to as great equalizers, but they're not. We know that these epidemics affect different Americans differently. We saw disproportionate increases in the number of homes sick who are immigrants, who are older workers, and who are workers with less education. And this squares with what we're seeing in our ICUs for those of us who are taking care of these patients. This epidemic is disproportionately affecting working class Americans of all races and ethnicities, and also Hispanics and Blacks disproportionately.
Just another study, Adam, and something else we keep learning as we go on in the middle of this pandemic. Adam Gaffney, thank you so much, a pulmonologist and instructor at Harvard. Appreciate your time.
Thank you for having me.